Good afternoon. How's everyone doing? Good. So this afternoon I'm going to spend a little bit of time discussing the chairside system Glidewell.io. .io is in office. And how many of you are familiar with Glidewell? Everyone's heard Glidewell before. Glidewell is a pretty nice sized lab in Southern California. We see cases from all over the country. We work with over 70,000 dentists. We fabricate millions of restorations for these dentists annually. So we kind of know a thing or two about making crowns, fabricating crowns for dentists. And we're excited to have this partnership with Align Technology with the iTero element. And that's what we're going to talk a little bit about today, the combination of the two systems, taking digital impressions with the amazing iTero, and then seeing what the possibilities are with the chairside system that Glidewell has fabricated and created, really to simplify the process of how can we provide high quality restorations for our patients. So this is really more focused on who we are as Glidewell. Glidewell is a team of over 4,000 dedicated people to making dentistry more affordable, making it more accessible to patients all over the world, providing high quality restorations. So this is kind of an inside look behind the scenes of what goes on at Glidewell. We certainly are more focused as a dental lab. That's how we started. But then materials development has come into play. If there's anyone that knows and understands CAD/CAM technology, it would certainly be the most innovative dental laboratory in the world, which is Glidewell, located in Newport Beach in Irvine, California. You can see some of the inner workings. Glidewell has been developing and testing and even manufacturing their own CAD/CAM technology for over 20 years, implementing that process into making the lab process and workflow more efficient so that we can provide these restorations to our dentist customers in a timely manner. You can see some of the work behind the scenes creating printed models. We have a team of over 100 people within our R&D department that develops materials not just for the laboratory. Everyone's familiar with the Bruxer brand. It's the most prescribed zirconia monolithic restoration in the world, with over 14 million restorations seated already. This is a CAD/CAM process to even make metal substructures for porcelain fused to metal restorations. So we have always been on the leading edge of developing the most technologically advanced methods to create restorations in the world. And that brings us to where we are today, with the partnership with the iTero element to take digital impressions, making the patient experience more comfortable, creating a more efficient process. Why is a dental laboratory creating a CAD/CAM system? It's because our philosophy and our mission at Glidewell is purely to make dentistry more affordable and to really put the best technology in the hands of the clinicians that can provide that for patients. If we can offer high quality restorations with the best materials and offer that to patients within the same appointment, single unit restorations, over 70% of what dentists do are single unit restorations in the posterior. It could be full coverage, it could be partial coverage. If we have the opportunity to use the technologies that we've developed in-house with the chairside design software and milling system, patients can get that high quality restoration within one appointment. And we'll touch a little bit more on that as well. When we talk about digital dentistry, this is what we see the trend of within the laboratory. Dating back to 2013 and at the end of last month in January, you can see this upward trend of digital impressions that are coming into the laboratory. So we certainly still have a majority of polyvinyl siloxane impressions, traditional impressions, but this is what dentistry is going. A lot more clinicians are believing in the technology, which they should, and I'm glad a lot of you are here looking at the intraoral scanner that iTero has. That's actually one of the highest number of digital impressions that we receive in the lab. this is what we're seeing. We're seeing a lot fewer remakes, over 17% fewer remakes from digital impressions. So that's why digital is really changing the landscape of dentistry. It's all about becoming more precise, more accurate, more efficient, improving the patient experience, improving the experience for the clinician as well. And that's where this ties into how we were able to develop a CAD/CAM system that's also easy to use. So I mentioned we have a team of over 100 people within our R&D department. We have scientists, material scientists, software developers, mechanical engineers, customer support personnel, and clinicians on staff, which I've been a clinician on staff for the last 2.5 years. And together with the technicians, I mentioned we fabricate several million restorations annually. We certainly know a thing or two about how to create that process in the most efficient way possible. So by combining all of this knowledge, this brain power that we have within Glidewell, we wanted to develop a system that was so easy to use that clinicians can then take a very easy system like the iTero. You can just really just pick it up. The learning curve is virtually non-existent. It's so easy to capture these scans, and combining that with the materials technology that we have that, again, developed in-house for the lab process, but now we have those available chairside. So we'll introduce you to some of those materials as well. Just really brief about myself. Before I became a dentist, I actually was a dental technician making restorations by hand. And when this whole concept of chairside CAD/CAM came about, I actually was a little bit concerned. I spent a lot of time and money invested into learning how to make these things by hand. Waxing up, PFMs, gold restorations. And I was a little bit upset, honestly. But once I understood what the technology offers the patients, it's all about what the technology can do to improve the lives of our patients, improve that patient experience. So from that point on, I actually became a trainer for a CAD/CAM company in Dallas, E4D, for several years. And through that, working with dentists and their patients, I became inspired to want to take the next step to go on to dental school because I believed in the technology. It actually inspired me to want to take advantage of that technology, seeing where the technology is going, and improve patient care that way. Again, if the materials and the technology and the quality of the restorations match that or even exceed what I can make by hand. So some of the things, whenever you're going about learning about all the different systems, there's certainly a lot of the systems out on the market. You really have to ask questions. There are certainly lots of different bells and whistles that each system offers you. So these are just some questions, general questions I would like for you to keep in mind. You owe it to yourself to try all the systems, get a feel for it, but really there are maybe some hidden fees or some things that you may not consider right off of the bat. Certainly the features are going to be important. You have to understand every practice is slightly different. CAD/CAM may be different for each practice, whether or not you can accommodate multiple operatories to have a patient wait chairside. But one of the nice things with chairside CAD/CAM dentistry is dentistry at your own pace. We talk about same-day restorations, and certainly if we have the opportunity, we are the only medical profession that makes an incision in the body, and rather than, if it's an indirect restoration, rather than sealing it up right away, what do? We send the patient home with a loose-fitting Band-Aid, and as we know, teeth shift around, the teeth are moving dynamically, and it's a wonder how things fit after so long, maybe a week or 2 weeks later. So we have to keep that in mind. If we have the opportunity to seal up the tooth right away, is that better? I would say yes, especially again, if we can make a good fitting restoration chairside with a high quality system. So again, just some questions to keep in mind. Materials on top, the fees, the licensing, some have different maintenance fees. per click fees for each use. Also the materials. Think about the materials you're currently using. If you're using glass ceramics or if you're using more zirconia-based restorations, some systems have different processes to fabricate those restorations. Some may take longer. So really get a very good understanding of what that process is for each system. Again, knowing what you currently do, and that'll allow you to transition a lot easier into a chairside CAD/CAM process if that's what you're looking for. Some other questions. Some of the other features, are you able to do bridges? Are you able to do single units or screw retained crowns? And also the support. I guarantee you, no matter how much development has gone into these systems, you're going to run into some problems. You're going to want to have someone to call, someone to support, someone to even log in and see what you're doing. Hold your hand a little bit, because I understand as a technician and now as a dentist, whenever I train dentists to get into CAD/CAM technology, there is kind of a steep learning curve, because you're learning not just design, you're learning all of these aspects that a lot of technicians struggle with the preps or the impressions that dentists give them. So now all of you are responsible for identifying margins, having to retract the tissue, making sure your preparation design is correct for CAD/CAM, because it's a little bit different, rounded internal angles and things like that. We won't really get into that, but having the support, having someone there behind you helping. Now, we mentioned Glidewell as the dental laboratory. Why do we have a chairside CAD/CAM system? Again, it's all about bringing the best technology and making it more accessible to more people. We're not concerned about chairside CAD/CAM technology as a dental laboratory. We're always pushing the limits of what the technology can do for patients and making it more efficient for clinicians. It's all about improving the well-being of the clinicians too. Can it be easier and more predictable, providing a more predictable and strong restoration for our patients? So we'll finish with a little bit of a preview of what this Glidewell.io system has to offer, just showing you the workflow. Using the iTero element scanner. If you haven't used a digital impression system, it's virtually a digital triple tray. You're going to scan the opposing, enough teeth of the opposing, and what's easy with their system is you just rest it against the teeth and sweep along. It's a video capture. It gives you instant feedback. You can see immediately what areas are missing. So we take a scan of the preparation, we take a scan of the opposing, and this is the buccal bite with the patient biting down in centric, so that we can correlate those two upper and lower scans together. And I always tell dentists, with digital technology, it certainly will make you a better dentist. Sometimes you'll be humbled by your preparations at the beginning when you can see it so magnified, much more than you can see with loupes or even microscopes. So seeing the areas where you can improve your preps. Once the scans are imported into the Fast Design software that was all developed in-house by Glidewell software developers, you mark your margins. The software will create a really beautiful proposal. And here I'm inserting a Bruxer Now fully centered block. This is the first time that it's been available in dentistry. Fully centered means that there's no post-milling processing that's required. So right out of the mill, just like this, it's 35 minutes milling and it's ready to be delivered. You actually don't need to fire this. There's no centering. But here, again, going back to myself being a technician, I kind of have to do a little bit of characterization. So I'm applying, this is completely optional. There is an oven that is available mainly for one of our lithium silicate materials, our glass ceramic that needs to be crystallized. But you can do a similar 10-15 minute quick oven cycle to stain and glaze and get a beautiful Bruxer crown. So this is, again, the first time a monolithic, fully centered zirconia crown can be delivered chairside without any post-processing. And having Glidewell backing the system, That's one of the greatest advantages of the laboratory being there to support you. At any point, I mentioned you may run into problems. There may be some multiple unit cases that you have trouble with, bridges or implants. You can scan, and if you even get through design, at any point, if you have some problems, you can just dial in, or there's a button that says send to Glidewell. You always have that fail-safe. You can send to us. We can then from that point fabricate the restoration for you. So never before has there been a dental laboratory, again the most innovative dental laboratory, supporting a chairside CAD/CAM system, because we want you to be successful to provide the best quality restorations for your patients. So I thank you all for your time. Are there any questions? Well, thank you all so much.